Getting older is part of life. Feeling older is optional. An injury from a fall can have a big impact on a person's health and well being. This video will discuss the impact of falls, practical steps to reduce fall risk, and reasons preventing falls may matter to you. My name is Stacy Frenberg. I'm a quality improvement advisor with the Great Plains Quality Innovation Network, and it's my pleasure to introduce two experts to tell you more about falls. Beth Bauer is a clinical nurse specialist with 40 years of experience in geriatric care. Lisi Brown is a gerontologist with South Dakota State University Extension. Her mission is to improve aging for all South Dakotans. Now I'll turn the presentation over to Beth.
Thank you, Stacy, for that wonderful introduction. Staying active is vital for staying healthy. As Stacy said, a fall can have a big impact on our physical and emotional health. But falling is not a normal part of getting older. You can take action to prevent a fall. The risk of falling increases with age. 1 in 4 adults aged 65 or older fall each year in the United States, and South Dakota is ranked 5th in the nation for death from falls for those 65 and older, and adults over the age of 85 account for over half the fall-related deaths. If you think this is just a problem for older adults, you need to be mindful that based on adults over the age of 45, 1 in 10 have reported an injury from a fall in the year 2016. These falls have a financial impact as well. To give you some perspective, the total medical costs in 2015 was $50 billion. That's like spending $95,000 each minute for the whole year. The cost of falls is expected to reach more than $67 billion by the end of 2020. Lisi will talk about how we can prevent these falls.
Thank you for providing the information about how common falls are in South Dakota and how much they cost. Now I'm going to talk about what you can do to prevent falls. Before we begin, let's talk about the 3 types of risk factors. There are 3 categories: physical, behavioral, and environmental. Physical risk factors are the medications we take, the foods we eat, our level of physical activity, chronic disease, and dehydration. Behavioral risk factors include engaging in risky behaviors. So for example, standing on the top level of a step stool while reaching into a cabinet. Another example is having a pet that darts in front of you when you're walking. Environmental risk factors refer to the design of your home and community. So with respect to your home, it's the steps that lead up to the front door. In the community, it could be an example of having the curb cuts in the sidewalk so someone doesn't have to step down off a curb. Everyone has had a fall at some time in their life. As we get older, our balance and coordination changes, and it takes us longer to recover from a fall. If we fall once, there is a risk that we become fearful of falling. When we are afraid that we will fall, it is likely that we will move less. And the research tells us the less physical activity and movement are a part of our life, the more likely it is that we will experience a fall. If you have fallen or you are afraid that you will fall, please report it to your medical provider immediately. This could be your nurse practitioner, a psychiatrist, your chiropractor, a physician's assistant, absolutely anyone you see for medical care. They should be able to help you schedule an appointment to have a fall risk assessment done. There are other things you can do to help reduce your risk of experiencing a fall. Get your vision checked. Schedule an appointment with your pharmacist to check your medications. Do a home fall risk assessment. Also learn about falls prevention programs in your community.
Fall prevention programs focus on activities that will improve strength and balance. Many who participate are more confident of their movement and more active. In addition, following provider recommendations will improve the quality of life. For many, quality of life means remaining in our homes longer, improved energy levels, and greater enjoyment of time with friends and loved ones. Getting older is part of life. Feeling older is optional.
Thank you for joining SDSU Extension and the Great Plains Quality Innovation Network to learn more about what you can do to prevent a fall. You can find additional resources about falls prevention on the South Dakota Trauma System website using the URL provided below.